We're here in San Diego at the 2016 American Society of Hematology, and joining me this afternoon is Dr. Heinz Gisslinger from the University of Vienna. Doctor, welcome. So a lot of exciting things going on at this year's ASH conference, a lot of innovation. We're hearing words like immunotherapy and combination therapy, and a lot of very exciting things going on in the field of oncology and hematology. And you presented some findings of a phase 3 study for the treatment of PV recently. Could you tell us about your study and what some of the findings were?
Okay, we compared a new formulation of pegylated interferon, which is named opaque interferon alpha-2b, with the advantage over the present available pegylated interferons that it has a longer half-life. So you have to inject interferon every second week instead of every week, and it results also in a better tolerability and probably in a better efficacy. This is the beauty of this compound in comparison to the other compounds. And now in this phase 3 study, we compared the first year of treatment with this interferon in comparison to hydroxyurea. Interferon, you have to know, it's a very slow-acting compound, so you have to use it during very long time, and the efficacy of this interferon will be seen after the first year mainly. So we saw that interferon was equivalent, efficient in comparison to hydroxyurea during the first year. There was no inferiority of interferon treatment concerning the efficacy, but there was a clear superiority, which was a surprise in comparison to hydroxyurea in the side effects and also in the dropout rates. Initially, we expected that interferon will have a higher dropout rate in comparison to hydroxyurea. The opposite was the case. For example, the dosing to the full dose schedule did take longer, 20 weeks longer in comparison to hydroxyurea to get to the full dose which is necessary for treatment of PV. And this maybe also resulted in a slower action of interferon, but we had to withdraw or reduce the doses of hydroxyurea in a higher percentage of patients in comparison to interferon. And when we looked then at the long-term results, we saw that interferon becomes clear superior in comparison to hydroxyurea concerning the hematologic response, but also concerning the JAK2 allelic burden, which was extremely important. And also a surprise, we saw 5 malignancies during this first period of treatment in hydroxyurea-treated patients. We had 2 patients who did develop an acute leukemia and 2 patients who did develop a non-melanoma skin cancer and 1 melanoma in comparison to 0 in the interferon-treated patients.